Hi, my name's Austin Atwell, and I interviewed Taylor Rainey. She's a healthcare administrator, and she's a professional insurance adjuster for a hospital in San Francisco. So the first question I asked her is, what is the effect of the Affordable Care Act on healthcare access? Taylor said, I've seen an increase in the number of patients who are insured. The Affordable Care Act is one piece of that, but the Medicaid expansion also increased patients' access to health care. Now, that Medicaid expansion and the Affordable Care Act, some people put them together, but they can also be seen as two different entities, especially because the Affordable Care Act is an actual law, and Medicaid expansion has only been picked up by about 30 states, Colorado being one of them. And there's still about over 15 states that haven't chosen at all. At the moment, they're not talking about it at all, and there's a couple states that are talking about joining that Medicaid expansion. So, unlike the Affordable Care Act, it's kind of a pick and choose by state. Taylor also said it has benefited people who are unable to afford their own private insurance. However, it has given some false sense of coverage because of health insurance that is being offered is not inclusive of all the services that people need, which is true. The Affordable Care Act and Medicaid together, if you have, say, an elective surgery, something like that your doctor does not think is medically needed, it can be declined by your Medicaid or the Affordable Care Act. Taylor's correct that the Medicaid expansion increased access to health care. 11.4 million people enrolled in ACA benefits in 2019, and 12.7 million were covered by the Medicaid expansion. So that's a lot of people that didn't have insurance that were suddenly covered by these new laws, which is awesome. Both are great programs. The only problem with that Medicaid is just what people are covered for, which they don't know sometimes. Does Medicaid have any effect on health outcomes? Taylor said Medicaid does influence health outcomes. Many people who qualify for Medicaid are more inclined to be proactive about their health because Medicaid will cover their services. So, you don't have insurance at all, and all of a sudden you have it, and you think, wow, I can afford to go to, like Taylor says, for example, going to their primary care physician. This leads to more positive health outcomes. Of course it does, because those primary care physicians are trained to give you all of that health information. Say you're having heart trouble, they tell you what to eat, they tell you all of that. And they can even tell you to go to a specialist who will help you out even more. A study by John A. Graves shows that southern states that have accepted Medicaid expansion show slower health declines than southern states that haven't accepted it. Now, this is because, of course, all these people suddenly have insurance. So they're going to their primary care physician, they're going to their doctors. They're getting the medical services that they need because they can suddenly afford it. And Graves says that the amount of people showing slower health decline is enough to even change the health ranking of these states. And the health ranking of states has stayed pretty stable for a long time because it's usually off of demographics and things like that. But now it's because people have this insurance, there's so many people that are able to go and get healthy that it's changing which states are healthiest just by this Medicaid increase. So it's pretty awesome. It's pretty awesome that there's so many people getting healthy out there. Should government-provided benefits replace private insurance? So if this is so good, why don't we all just have government-provided benefits? Well, Taylor says private insurance covers all of your healthcare needs at an additional cost. But government insurance covers treatment that is medically necessary, but in most cases will not cover other treatments. If you do not fall under certain diagnosis codes, then you'll not be able to be covered by Medicaid. Now, I've been through this before. I have insurance through my job, but it did not cover my sleep apnea stuff. Even though I was waking up 60 times a minute, I still had to pay a couple $1,000s for my test and to get my machine and everything just for me to sleep well, which sounds like something that should be medically covered because sleep is a big part of your life, but it wasn't. So that's something that probably wouldn't be covered by Medicaid unless you had the right doctor that said that your diagnosis code was perfect, which a diagnosis code just is what they use in their machines to decide if you are right for getting insurance for whatever is wrong with you. Both private and government insurance should be available to anyone who wants them, is what Taylor says, and I agree. That way, we can choose whatever insurance is best for us. We should all be able to choose what we need, when we need it, and I think that is the perfect way to go about it. Private insurance usually is not made to help those who are unable to afford insurance. It's usually more expensive, and more specialized. It's for people who just need special things, or they're able to afford that better insurance. And then government insurance is just a good way to help people that are unable to afford the private insurance. It really helps people who are below that poverty line and even middle class to be able to afford something that can just help them stay healthy, which is really just what we're all trying to do. So these are my references, and that's it. I hope that everyone learned a lot from what I had to say, and I hope you have a great day. Thank you very much.